Good morning. Welcome to the Audit and Performance Committee of Perth and Kinross Integration Joint Board for Monday, the 26th of June 2023. Can I welcome you all into this hybrid meeting? We're in a very illustrious room set up as a formal council meeting, so I feel as if I've got power. So I've got the gavel, but unfortunately I don't have the mute button. Donna has the mute button, so she really does have the power. So anyway, we won't make it too formal because we want to have a decent discussion today and a bit of sharing of thoughts. So welcome to the meeting. The usual process, if you've got any questions or comments, if you could please put it in the comments section and we'll pick it up from there. Okay, and apologies, Phil. We have Jackie Pepper. Anyone else? No further apologies. Okay, the next item on the agenda is the standard declarations of interest, and members are reminded of their obligation to declare any financial or non-financial interest which they may have in any item in this agenda, in accordance with Perth and Kinross Integration Joint Board Code of Conduct. Any declarations? Nope. Okay, that's great. We'll move on then to the minute of the previous meeting. That was of the IGB Audit and Performance Committee of the 13th of March 2023 for approval. Firstly, are there any comments, thoughts, amendments? Nope, we're all happy it's an accurate reflection. So that's a proposer from Councillor Illingworth. Oh, that's it. David. And we have seconder, please. Anybody online? Martin, thank you. Okay, moving on, we'll go on to the action points update. There are only 2 items in the action points update, and I gather that both of them have been carried out. That was the IGB risk workshop, which was completed on the 15th of March, and the other one was the IGB development session. The clinical care governance was completed on the 5th of May. So well done, everybody. I just note the comments, a further session will be held to consider the draft risk appetite date to be confirmed. That is, Chris, we talked about that's a possibility to give the feedback of the risk meetings. I personally found that a very useful session, and I think that there was a lot of good positive feedback, so it'll be good to close that loop and give people that feedback. So thank you for that. Matters arising. Are there any matters arising that anyone wants to bring up at this point in the agenda? No? Oh, I've got an early coffee today. Now moving on to the meat of the meeting. Can I hand over to you, Donna, to take us through the financial position, please?
Thank you, Chair. Good morning, everyone. Thank you, Chair, and good morning, everyone. This financial report is to provide the committee with an update on the IGB's final financial position for 22 and 23. The report is highlighting that the service areas within the main over and underspends and the reasons why, and it's also providing an update on the COVID-19 reserve spend and a summary of the IGB's reserves held at 31st of March 2023. The report notes that the position did move from the last financial report presented, but this final position is in line with the underspend that we predicted to in order to set the budget for 23-24. You will recall that to balance the budget for 23-24, we approved the use of reserves to help meet anticipated one-off spend pressures, and this final position for 22-23 confirms that this funding will be available for us to do this. The report details the main areas that have over and underspent in year, and this highlights the level of underspend against staff budgets. And although this is the main contributor to the overall underspend for the year, it needs to be considered against the considerable investment in 22-23. This investment required planning, recruitment and implementation, and this came whilst a number of services and therefore staff capacity remain focused on the unprecedented demand and COVID-19 related activity. So whilst the core budget had underspent, and particularly this was on staffing. There was considerable staffing expenditure against one-off funding, such as COVID-19 reserves and our winter resilience monies. So the importance again to reflect that some services remained in response and resiliency mode, and that was played out through how financial spend came through. So as noted in the report, the IGB's financial plan underpins the strategic delivery plans that we've approved. These plans are now well underway, and our challenge now is to shift from responsive and resiliency to ensuring that funding is used on our planned actions. And this challenge was recognised in our 23-24 budget, where one-off funding has been used in order to allow this transition this year. Happy to take any questions or comments on the report.
Thank you. David.
Thank you. I noticed in the report that the issue over the £400,000 for charging 2C practices is still outstanding. What are the barriers to getting that resolved?
Thank you for your question. Yes, so it remains an issue, and it is something that we have recognised that we need to take forward in 23-24. There's nothing now that we can do around the 22-23 position, and particularly with the very recent events that we've had around primary care service that needs to be taken forward. There's conversation ongoing with the 3 chief officers, and they have asked that the chief finance officers now take this forward. So we would hope to have something to update you on by the next IGB or Audit and Performance Committee.
Yeah, I'm sure that everybody here can imagine the concern that Perth and Kinross are paying £400,000 for a service we just don't get. And I'd much rather see that £400,000 a year going into our reserves than into Angus and Dundee's reserves.
Thank you, David. I understand the point that you're making. The one thing I would add is that we've got to be very careful about the overall picture and precedents, because although primary care is led by Angus, and we seem to be putting a lot of money in, we have to look at the parallels with mental health and what we're looking from other people to give to us. So I think it's part of an overall discussion on the lead agencies as well as just simply primary care. So I know that the 3 chief officers and 3 finance officers are certainly looking at it with the NHST side board. So we'll look forward to the report coming back at the next meeting. Thank you. Any other questions? Martin?
Thanks, Chair, and thanks for the report, Donna. The question I have, and there obviously is a significant underspend due to staffing. Obviously, then that impacts on the service delivery. Is there a future recovery plan how we can get back to being able to offer the level of service that we could?
Thanks, Matt. And I'll maybe answer some of that question and perhaps refer to my colleagues to give a bit more detail. What I was keen to pull out in the report was that although we have got a considerable staffing underspend against core budgets and those actions that we wanted to take to realise the full investment that we have, for the same amount of underspend we've seen against core budgets, against staffing, we've seen perhaps the exact same amount of spend, against staffing, against one-off funding. So although staffing against core budgets, that same amount, there's been a spend against one-off. So again, that's just about that challenge of moving us away from responsive one-off delivery and moving that into our planned delivery. So I just hope that gives a wee bit more clarity on how we've seen the spend come through, but I could refer to either Evelyn or Kenny on the services.
Yeah, as Donna says, there is work underway at the moment just to try and work out what our core requirements are going forward. That said, there are well documented shortages in a number of professions across the partnership, namely social carers, nurses, allied health professionals, medics. And we do have actions in place to address the shortfall across those various professions. For example, in social care, we have recently funded a post in our communications team. And that's just, for recruitment drives, that's just increasing the impact of the recruitment drives through better use of social media, etc. We're also applying to be part of a pilot with the Scottish Government for overseas recruitment as well. So that's something we're looking at. There's been a lot of work going on in HPs and nurses as well. Again, at an NHS Tayside level, overseas recruitment has been looked at there. In terms of nursing, we have been looking at contracts, terms and conditions, etc., to try and attract more people in. I don't know if Evelyn's got anything further to add on that. No. So, in short, yes, there is a plan in place.
Okay, thank you, Martin. Are you happy with that?
Yes, I was just wondering if there's also within that plan, there's the opportunity for upskilling in some of the services and the support for upskilling.
Yes, there is very much so, certainly in terms of social care and also in our nurses and AHPs, we are looking at upscaling non-qualified staff to get their professional qualifications, and also, creating posts in between the two as well, just to try and enhance people's skill level and help them on that career pathway. And again, what I should have said as well, this is supported by the overarching workforce plan that we've got for the partnership that has a comprehensive action plan attached to it.
Thank you, Martin. I see we've got Sheila and then Sandy.
Hi, actually Martin's asked my question and it's been answered, so I withdraw the question. But if I can make a comment, if I may, Chair, if it's appropriate, or I can come back in at the end of questions.
No, that's fine. On you go.
I think the point that both David and Martin raised are both quite valid, particularly for members who perhaps are not involved with the health board and don't see the bigger picture. And I certainly think it might be something worth bringing back in future, just to try and help explain how all these costs, in theory anyway, at least balance each other out across the IJBs and the health board. And also in relation to the staffing, I think, while I'm reassured by everything that Kenny has said, I think it might be helpful, by the time we meet again, we'll be well into this new financial year to see exactly where the real troubles some areas are, and perhaps a bit more detail about the impact of service delivery.
Okay, thank you for that.
Thank you.
Can we have Sandy? Sandy Watts, please.
Thank you, Chair. My question follows on from both those, I think. We often talk about understaffing and the fact that we've got the underspends. I never feel as if I've quite got a grip on what the extent of the problem is. So I wondered if there was any data available that would help us understand the picture of where the vacancies are. Is it I know there are geographical issues, and I think Kenny before referred to different departments maybe having difficulties, but are we talking about long-term difficult to fill vacancies? Is there a high turnover? Is there a low retention rate? So I feel I don't really understand exactly what the problem is that we're trying to deal with.
Thanks, Sandy. I mean, I'm sure there is data that breaks that down, but I'll hand over to Kenny.
Yes, I mean, we certainly monitor the number of vacancies on a monthly basis across all the professions in health and social care, and we monitor retention rates as well. I mean, for example, social care historically has had high turnover rates, and we have taken actions to try and reduce those turnover rates. So we've had some success there. I mean, again, we do have plans in place. There are real challenges ahead. I mean, there are shortage across Scotland of a range of professions. And again, just with the geographical location of Perth and Kinross, we are essentially competing with a number of neighbouring areas. So it's about trying to promote Perth and Kinross as a good place to work in general, as well as the specific actions relating to the various professions in the workforce. But yeah, like I say, certainly on a monthly basis, we are tracking the number of vacancies in each of the professions and looking at retention rates as well.
Thank you. And I wasn't trying to suggest that it wasn't being monitored. I just wondered if there was more information available for us as the IJB board. And maybe it is just me, so that we understand better what's actually going on. But I mean, maybe it's not appropriate to give that information to the board. I'm not sure.
I mean, again, we'd be happy to discuss this possibly with the meeting in terms of bringing that information either to this or to the IJB. The workforce plans progress is being reported to regularly. I think it's 6 monthly at the moment to the IJB. It may be that information could be contained in the update, but again, happy to have discussions about the best way to provide that information for the IJB going forward.
Thank you.
Donna, you want to take on?
Hi Sandy, I just wanted to add to that although the financial report shouldn't be the main report that provides you with that information, we can try to ensure that the first financial report of 23-24 tries to capture some more detail around whether it's a long-term issue, a high turnover issue. Because I would say that in coming to that final position for 22-23, it was a mixed bag of everything that you talked about there. There's areas with long-term issue, there's areas with high turnover, there's areas with high investment that we haven't been able to implement fully yet. And then there were areas with recruitment challenges that we're seeing nationally that are perhaps more of a recent issue. So it is a mixture, and as much as there's probably a better source of the data in its entirety, we will try for the next financial report to pull out where we can and give a bit more detail.
Thank you.
Thank you. I think that it might be worth as a one-off additional agenda item for the next audit and performance meeting to have a subject, a heading, to break down the staffing situation and where our problems lie, in a one-off situation to give us all a chance to have some discussion around that and get some information to feel we know what's going on and feel reassured, which is the whole point of the audit and performance agenda. Because personally I'm interested in the amount of temporary jobs we have and the amount of permanent contracts, because I know there are some posts that we've had to fund on a temporary basis, which we might need to transition into permanent funding to get recruited, etc. So if everybody is happy, we'll have a further full discussion at the next meeting, and if a combination of finance and Kenny and Evelyn could give us a bit further, maybe even a presentation on the main areas. Hopefully that will resolve this. Any more questions in the room? Yep, and I'm sorry, I'm just reading comments there from Sheila. Thanks, Sheila. Okay, thank you very much. We'll move on to the next. Oh, sorry, David.
Yeah, I just thought the report was extremely clear and very well written, so I'd like to thank the officers for that.
I forgot that you always do that to me, make me look bad, don't you? Thanking everybody and I don't do it. Thank you, Donna. Thank you, David. Right, moving on to the governance and assurance section of the agenda. It's the strategic risk management update. Can I hand over to you, Chris, please? Thank you.
Thanks, Chair. I'll very briefly skip through the highlights of the paper. Happy to take questions and revert to colleagues where appropriate. So this is a routine report to the Audit Performance Committee on work done to manage the strategic risks that relate to the Integration Joint Board. There's a summary of the risk register at Appendix 1, and that covers the current position and also presents a map of the movements of risks over time. So you can see the movement that's existed. I think it's on page 2 of Appendix 1. Recent review of the risk register was undertaken through Executive Management Team, which is our routine approach. And section 4 of the report sets out the movement in the risks from the last time they were reported to this committee. Table 1 provides some detail on those movements, and provides a brief narrative explanation of the justification for the movement in scores. We, as part of our routine risk management approach, we review operational risks that relate to Perth Cross Council and NHS Tayside, and we assess those operational risks in respect to their significance, in respect to how significant they are, in respect to the IGB's strategic aims. There have been no new operational risks that are of sufficient stature to warrant a new risk being added to the IGB's risk register. Overall, the risk profile, pleased to say, has moved in a positive direction. The risk profile has declined slightly since the last time the Audit Performance Committee have seen this, the risk register. And I think you mentioned an earlier agenda point. One other thing to mention is we'll have a further development session to follow up on the success of the previous development session on risk appetite, and that's really to reflect back to IGB members what we heard during that risk appetite session, to make sure that what we've heard during that session is exactly the intentions of the IGB, and then we will bring forward a risk appetite statement for approval later in the year. I don't think we've got that nailed down in terms of the meeting that's coming to, but I think it'll be towards the end of this calendar year, certainly within this financial year. I'm happy to pause there and take any questions.
Thank you very much. First, Martin.
Thanks for the report. Thanks, Chair, and thanks for the report. I have two questions, primarily on the SRO 6 in Table 1, and that's the widening of health inequalities. And then when I look further in there, I'm thinking it's the widening of health inequalities based on COVID. Obviously, with significant staff shortages, then the widening of health inequalities is not just contingent on COVID, I would suggest. And secondly, and it's to do with mental health, and I think it's number 13. And I know it's no longer a risk to Perth IGB, but where is the risk now going to lie? Because obviously there's an element of that risk must it still belong to Perth. That's it, Chair.
Thank you, Martin. Yes.
Thanks, Chair. Thanks for the question. I'm not sure I got the actual question in respect to the SRO 6, and perhaps we'll come back to that just in a moment. In respect to the mental health risk, the reason that that's been taken off our risk register is to do with that specific risk related to the governance arrangements that exist around mental health across Tayside. With those governance arrangements having been clarified, that specific risk no longer relates to this to Perth Cross Integration Joint Board. That's not to say that there are not risks in respect to mental health across Tayside, and those are managed from this point forward through the whole system programme that is managed separately from the Integration Joint Board, with Jackie as the lead partner for strategic planning. So that's why that specific risk has been removed. It's not to suggest that all mental health risks have now been removed from the system. Hopefully that answers that question.
It does, it does. Yeah.
I'm not sure I just understood the question in respect to the initial one. Could you maybe just repeat that?
The SRO 6 is talking about widening health inequalities as a consequence of COVID-19. There is a risk that health inequalities will widen significantly. And yes, that risk is obviously there with long COVID, but also the impact in not being able to address some of these. I think that the level of risk that was shown there, and maybe it's shown as red on the next one, but it's shown as amber. No, it's not. It's shown as is amber, and I think it's probably higher than amber. Either
Yeah,
that or
yeah.
I'm just misunderstanding this totally.
No, thank you. Yeah, it was me that misunderstood the question. Thanks for that. Yeah, so that risk description has been recognised as not being broad enough in respect to calling out COVID, and is scheduled to be redrafted. So an updated version of that risk in respect to widening health inequalities would be brought onto the register, as opposed to the narrowness of the previous description.
Thank you.
Thank you. We've now got a question from Sheila and then David. Sheila?
Thank you. I have a few questions and I'll try and keep them brief. The first one really is around the strategic risk plan, Appendix 2. And I noticed that in all of them, the review date is the 1st of June, which is passed. And I'm just wondering, is there a change in the target date, or what? Is the target date reflective of the review that was held in June? So that's the first question.
Happy to come back on that.
Okay, if you want to do them, that's fine. Yeah.
So yeah, the review date within the action log is set at when that action was initially drafted, and the RAG tells you whether or not that action has been progressed to the point where it's complete or where it's outstanding. So where it's past the review date, that's not to suggest that action is not still being taken forward. What we've tried not to do is to simply move the review date to a point at which the action becomes green again, because it makes it look like the progress has been made to the point where it's actually getting complete and is staying green, rather that the original review date stays and we can recognise that additional work is still required in order to close that off. So it's just about the presentation of how the action log is noting whether or not the outstanding actions are complete or not. Hopefully that makes some sense.
Well, it does actually, and I actually support the idea of not necessarily changing the original dates, but somewhere we need to have the revised target date, for example, because the target dates, quite a few of the target dates are before the review date. So if I understand you, the review date is the date the risk was first reviewed, or was it the date it was raised?
I'm going to revert to Phil.
Hi, thank you. I think we probably need to express that a bit clearer. The review date on Appendix 2, the risk improvement plan, relates to the last time the improvement plan action was reviewed by our executive management team. It's attempting to show that executive management team regularly look at these and look at each action and make a judgment on the RAG status of it and if any further actions are needed. So it was last reviewed at our EMT meeting on the 1st of June. That's what that review date column means.
So it could be called the EMT review date.
Yeah, we probably need to call that out a bit clearer.
So then I come to the target date, because the very first one at the very top is a target date that's almost 2 years old. So the two don't, for me anyway, look as though they're aligned. So is there a revised target date? I mean, I do understand that initial target dates very often in these things do move because we're living in a not a very fixed environment, but it would be helpful, I think, to have what the revised target date is, maybe following the EMT review, for example. So we as well as the original, because there's not a date raised, so we don't know how long these have been on here. We don't know what the new target date is, because that puts the action plan into some sort of context.
Yeah, that's certainly something we could look at so we've got a full timeline of when it was raised, the original target date and the revised target date.
Yeah, I think for me, that's what I'm more used to.
Yeah, okay, we'll take that on board. We do call out any changes to the target dates in each report. EMT make a judgment on whether it's appropriate to change the target date or not. By changing the target date, it would probably change the RAG status back to green. Sometimes we want to keep it at red. So, but we'll certainly look at that so there's a full picture.
Thanks. So I think this committee needs to know what's going on. And I think not removing a target date to avoid changing the RAG status is not something I would necessarily encourage, to be honest. But at least that helps explain it. So thank you very much. The second question I have, if I may, Chair, unless you want me to come back.
That's fine, Sheila, keep going while you're on a roll.
You might regret that. The inpatient mental health services said it's no longer deemed a risk to the IGB strategic aims, but the paper that was presented to us at the IGB last week, yes, just last week, included reference to learning disabilities that wasn't just inpatient. And while the primary risk rests with the with Perth and Kinross IGB, there may be secondary risks associated with that we still need to keep an eye on from a local perspective. And it's actually something that came up at the Health Board Audit and Risk Committee as well, about where does the primary or the parent and the child risks sit, because they're not all fully vested in one organisation or the other. So I just think that we need to maybe have a little think about how we consider these things, because there still will be a risk to our delivery of day-to-day services, for example, to adults with learning disabilities who receive care at home or require outpatient services. And so while this is primarily a document in inpatient services, in terms of learning disabilities, it's got a slightly wider scope. So I just think we need to be careful about removing a risk entirely, and we need to consider what is, like I said, in this case, it would be the child risk, where the parent might sit elsewhere, parent risk might sit elsewhere, and vice versa. I think if we are responsible for a parent risk for an initiative that we're leading, or a responsibility that we have in Perth and Kinross, that we need to also make sure that other IGBs and indeed the Health Board are aware of what their secondary risk might be. So that's maybe more a comment than a question, Chair. Thank you.
I think one of the questions that keep coming up in my mind is attending various committees. I don't think any part of the organisations have tied down where mental health risks are sitting, because I think it's like pass the parcel at the moment. So I think it is something that this committee would like some clarity on from the executive management team around the risk. I also think that maybe some of the challenge, Sheila, for us is when you talk about partner and child risks, I don't think
parent and child.
Could I say partner? Parent and child. I don't know if that's a system that we actually use. I'll hand over to Chris to just for comparison. Thanks.
Sorry, that's my project management background coming out.
Yeah, I mean that's fairly standard. Yeah, we recognise the approach that Councillor McCall's referring to. The methodology that we used isn't specifically calling out parent and child in the way that Councillor McCall's suggested, but it's not one that's alien to the discussions that we have. The risk the risks that the committee are reviewing nature and relate to the Integration Joint Board's delivery of its strategic commissioning plan, and where there are other risks in the system, particularly in reference to the delivery of services, they'll be held within the partner agencies, both within NHS side or Perth Cross Council. We review those on a regular basis, and we regularly meet with colleagues in NHS Tayside and the other HSCPs in order to, if you like, do that horizon scan to recognise the extent to which risks elsewhere in the system may or may not be of significant nature and relate to the Integration Joint Board's strategy. And that's the judgment that's made in bringing the risk profile to the Audit Performance Committee today.
Okay, but how are we as an audit performance?
Sorry, Sheila, I was just going to say, you look as if you're ready to come back in.
Yes. So how is the Audit and Performance Committee here meant to fulfil its obligations if we don't get sight of what's considered?
So the Audit Performance Committee receives assurance reports from the Clinical Governance Forum and the Egg Committee and Perth Cross Council Scrutiny Committee in respect to what is reviewed at an operational level. I think Mr. Ogilvie might want to come in.
Yeah, I was just going to make that point in terms of operational risks. That's how operational risks would be flagged up, and there's a report at the end of later on in the agenda for this meeting. In terms of cross-cutting risks, we have got our Protecting People subgroup as well, and that looks at cross-cutting themes across the whole age range. And there's representatives there from the Alcohol and Drug Partnership, Violence Against Women, Adult Support and Protection, Child Protection, etc.
Okay, Sheila?
Well, not really, no. But I don't want to hold up the whole meeting. I think it's a question that is being asked across certainly at the health board level, because none of these risks, well, not all, some of these risks can be 100% wholly within the scope of the IJB, but there are a number of issues and risks that are either shared or may have an impact elsewhere. So I just feel that we're only seeing a sanitised version of what the risks might be, and we don't really see in this committee anyway the underlying risks. I've no doubt, by the way, Kenny and others, that they're being dealt with and looked at, but as an audit and performance committee, I think that we're not seeing everything that's there. And I think part of our job of scrutinising on behalf of the IGB specifically is that we need to be able to understand what the full scope is. But I'll have some thoughts about that and maybe speak to the chair offline if that's okay.
Yeah, that's fine. It may be that we need to have an offline meeting to just go through some of the risk processes for reassurance and what comes to this meeting.
Yeah, because mainly just because I'm also in the audit and risk committee for the board, and I know that's been a subject of discussion, including with the auditors, around how we manage risks and where they should sit. So
yeah,
okay.
Sure that. Okay, that's fine. Thank
yeah, you do. Of
Dave.
course, you sit in the same committee, so you understand where I'm coming from on this.
Yes, I do. David.
Thank you, Chair. I know that setting probabilities and impacts is not an objective process, but I do think reducing the probability of financial resources being an issue from 5 to 4 is a bit optimistic in the long term, but that's just a comment.
Do you want to take that, Donna?
I'll have it come in, even though it was just a comment. It was more to reflect that the financial resources were considered as part of our 23-24 budget, and that risk for 23-24 was decreased from what was sitting at prior to us setting the budget, because we were able to ensure in the budget that the strategic delivery plans could continue. Now we will need to keep this under review, obviously quite closely throughout the year, but at this point of the review, because we were able to set the budget, we were able to continue to underpin the strategic delivery plans, therefore we were able to reduce the score at this time.
Thank you.
Thank you, David. And can I thank Chris and Phil for this paper and the work around the risk, and we'll take offline discussions around the details behind the risks that are reported here and referred to at the next meeting. Thank you. So we'll move on now to the internal audit progress report. So I'll hand over to you, Jackie.
Thank you, Chair. The report in front of you details the internal audit progress for the current and previous year's plans. Currently working on the plan for the IJB, and this particular report highlights the, assignment 2201 on leadership capacity, which was a consulting style assignment, and this is being considered alongside but separate to Perth and Kinross leadership review. So this is not yet complete, but the work that internal audit is doing is providing a critical friend approach, and no report will be considered by this committee, no separate report will be considered by this committee. The assignment 2202 on sustainability of commission service providers has been paused due to capacity at this point in time, and assignment 2203 on premises and property, this has commenced, and we're anticipating that that will be completed over the summer. I'm happy to take any questions if appropriate.
Thank you. I just want to get clarity on, you're saying that you've paused the sustainability. It's just to get clarity that we hope that this will be completed in the year. It's not going to be put into next year. Thanks.
Thank you. I'll be connecting again with the service around about October time to see when and how we can take that one forward. It's currently the intention that this will be taken forward this year, but it will be later.
Is that going to impact for any reason on our winter planning and our winter sustainability thoughts, Evelyn?
I wouldn't think so, Beth. We're already beginning to set up our winter planning group and working with Tayside and Scottish Government as well around winter planning. So no, I don't think about.
Thank you, Evelyn. Sheila, have you got a question?
I have, yes. On the sustainability of commission service providers. You said you're going to look at that in October, but I think at the moment, is there not a tender process going on for some commission service providers? And do we need to be aligned with that?
Zoe?
Yes, there's ongoing tender activity, Sheila, but we wouldn't stop that for the internal audit process to take place.
But might there be an input from the internal audit process into that? Because this is a Scotland Excel-led nationwide commissioning process for certain services. So I'm just wondering if we'll do our audit report and then have some findings, then it's maybe too late to influence or have any findings that we might want to feed back into the commissioning process, or the tendering process rather.
We're already a member of Scotland Excel and the support framework certainly, and intend to remain as such, but we don't just use that framework to tender our activity, and in fact in general we don't use it. We tend to use our own internal mechanisms for tender activity, so there's a combination of ways of taking that forward, but the internal audit wouldn't have an impact on either of those activities.
Okay, thank you.
Thank you. Any other questions? Can I just ask one that's just come to mind there? Sorry, Jackie. It was just the premises and property. It's about the delivery of services on behalf of the IGB, but there's also a risk about the premises for here. Is that right? So there's something about where the accommodation. Who is it that's is it just you that's carrying out that audit, or is that in conjunction with NHS audit?
That audit's been undertaken by NHS colleagues and it will take account of wider risks.
And the last thing I was going to ask, the leadership capacity, will there be any verbal reports coming back, or is that purely between yourselves and management?
Any updates will be captured within the progress report.
I see a question from Martin.
Thanks, Chair, and thanks for the report. I'm only questioning for my own understanding, what significant changes will make it more appropriate to do this in October than continue the now? Where's the significance in this pause?
Zoe, you're going to take this one?
We don't have sufficient staffing to support it, unfortunately. We've had long-term sickness and problems with recruitment in the commission services team. So at the moment, I'm the only person who's managing the service. So I'm afraid there's just a lack of capacity.
Okay, thank you. I just assumed it was the audit team that was lacking capacity. That doesn't sound right. I just assumed it was your team. I didn't realise it was your team, Zoe. Sorry. I think that's useful clarity. Thanks.
Chair, just for is there no possibility that then a temporary secondment would enable this process to continue?
Not really. It wouldn't be hugely helpful, Martin. The problem is that you need somebody who understands the system and the activity. So seconding somebody in wouldn't be helpful. It would be more difficult for them to be able to access the information that internal audits seek, which goes down to a very operational level. So no, it'd probably be even more difficult for me to manage that process, to be quite honest with you. So we have a new team leader has commenced, but only within the last month. So it'd be very unfair to ask them to manage an internal audit process at the moment. So I think that's a sensible approach, given we've got the strategic commissioning plan consultation activity and some very large tenders going forward at the moment as well. So yeah, too stretched, unfortunately.
Thanks for that clarification. Thanks.
Thanks very much. It might be useful, Jackie, to actually put that in the report about the fact that it's not your team that are lacking in time, because it does change my thought process about where the problems may lie and for supporting the teams. Okay, thank you. Any more points, clarity, questions? Thank you, Jack. We'll stay with you now for the internal audit annual report.
Thank you, Chair. The Integration Joint Board has responsibility for reviewing the effectiveness of governance arrangements, including the systems of internal control, and public sector internal audit standards require me as Chief Internal Auditor to provide an annual opinion on these areas, and this report fulfills that requirement. The internal controls include a full range of policies, procedures to ensure that the conduct of operations and achievement of the objectives. This includes the processes, procedures, structures, job descriptions, authorisation limits and so on, which all form part of the core governance arrangements. Internal audit plans its work against the risk management framework and covers key risks to the organisation in achieving its objectives, taking into consideration previous audit activity around those key risks. In 2022-23, there was 3 specific assignments, with one being paused as being discussed and the others progressing and progressed. We've also finalised work in relation to previous years' internal audit plans. So all of the above has been taken into consideration and has fed into the internal audit opinion, which you'll find at section 6. And the annual Chief Internal Auditor's opinion is that reasonable reliance can be placed on the Integration Joint Board's risk management, governance arrangement and systems of internal control for 2022-23. This opinion, which is documented here, feeds into the annual governance statement process, which will be considered later in this meeting. I'm happy to take any comments or questions.
Okay, any comments, questions? The only thing that I was going to ask, it's really the statement broadly satisfactory. That's quite a wide term. What does he mean by broadly?
Thank you. We tend to work within the definitions that come from SIPFA. Broadly satisfactory really means that in general the majority of things are in place which we would expect to see and which would provide reasonable assurance. The 4 levels of assurance are substantial, reasonable, limited, and no. So there's no kind of middle ground, and we're above that. We're on the positive side, if you like, with reasonable assurance. Thank you.
Any other? Oh yes, Sheila, do you want to come in?
Yeah, just briefly, I don't have a question, Chair. I just really wanted to thank Jackie for the work that she does in the internal audit team. I know that resources are stretched, and I think that the work that's carried out is very good and diligent on time. And I know that from my PKC hat on, really, and which is why I probably didn't pick up any concern about reasonable reliance. So anyway, but I just want to say that, Jackie, thank you very much for all the work you do.
Thank you, Councillor.
And that's me beating again to say thank you. Beat you, David. So yeah, If there's no other points, then thank you very much, Jackie. And I do appreciate the work that you're doing, and it's particularly interesting. Again, it's quite striking that I just made assumptions that I knew that you were pushed for staff as well. So I just assumed it was your challenges rather than our challenges. So thank you very much for that. Okay, we're moving on to the next stage of the agenda, is the annual accounts. Now this section, the last sections of the agenda have been for no time, but these documents in the next section are for approval. So can I hand over now to Donna for this section? Thank you.
Thank you. The annual governance statement is a key part of the annual accounts, and it is an accountability statement on how well we have delivered on governance over the course of the year. It can be used to identify areas of improvement and provide us with an opportunity to improve and therefore reduce our risks. The statement is to be considered for approval today, to then be included within the annual accounts that we're going to consider next. The annual governance statement is Appendix 1 to the agenda, and it's presented to show what we do to demonstrate good governance under each of the fundamental elements that are laid out, and that includes leadership, culture and values, stakeholder engagement, vision, direction and purpose, decision making, organisational development, scrutiny and accountability, and internal controls. So under each of them, we document the improvement activity within the year 22-23, and then again under each element, we identify the actions for 23-24. So I'm happy to keep the introduction brief and stop for any comments or questions to that report.
Have we any comments, questions? David.
Thank you. Well, what are the main differences between this year's report, or this year's AGS, and last year's AGS?
The layout of the report is broadly similar, and the sections to which the report's laid out that are listed there around leadership, culture, values, stakeholder engagement, the way that we've sectioned it, again, is similar to the layout of last year. The key changes, which I find visually quite help, is that the improvement activity that we've taken during the year is sectioned off in each of the grey boxes with under the headings. And then when we come towards the end of the annual governance statement, it's noted what actions we will be taking in 23-24 to further improve on each of them.
Right, thank you.
Martin, you got a question?
Yeah, I think it's a good report, but I wonder, should it include sometimes timescales? There's quite a lot to be achieved in the action plan, but I'm not clear where the timescales are, how it's got to be achieved.
Thank you. Yeah, so for the annual governance statement and its presentation, we probably wouldn't put that detail in this, although we could perhaps put a link to our improvement plan, which will detail the action and detail the target dates, etc.
That would be worthwhile.
Thank you.
Okay, any other questions, points of clarity, comments? Nope. So do I take it that we approve the governance statement, the annual governance statement? Agreed. Okay, thank you very much. We'll move on to the annual accounts.
Thank you very much. I'm pleased to present the IGB's unaudited annual accounts for 22-23, and I very much would like to acknowledge the work of the Health and Social Care Finance team, which is led by Mark Grant, who I think's joined us online, and all the work that the team have put into ensuring that the accounts can be presented today. And also to acknowledge the work of our EMT colleagues for their contributions and their support in preparing particularly the management commentary, which is a key part of the annual accounts. And finally to Phil Gerard and Chris Jolly for all their work and their help on preparing particularly the annual governance statement and the management commentary. So I hope that indicates it's very much a team effort, and for me personally, it's very much appreciated. Thank you. As well as the annual governance statement that we've just considered, the accounts include the management commentary, which aims to provide a context for the financial statement, the financial statements, and to provide an insight into the priorities of the IGB and the strategies which we have in place in order to achieve these priorities and objectives. The accounts also include the remuneration report and then the financial statements themselves. The accounts have been prepared in the same format as you've seen previously, in previous years, and there's nothing that I need to draw your further attention to. So once again, happy to keep the introduction brief and to take any questions or comments on the accounts.
Okay, thank you. Have we any questions, comments? Nope. Nope, I mean, both documents are very clear, well written. I think they're very accessible. Documents, I've seen a lot of annual accounts and governance statements which are not quite as accessible. So I would offer my congratulations on that. And I do appreciate the amount of people that are involved in this kind of work, and thank you from the committee. If there are no questions, no challenges, etc., can we approve the signing for the Chief Officer for the annual accounts? Agreed? Okay. Thank you very much. We don't need to do anything about stopping and going and reading signatures and...
No, that's October.
That's October. Oh, I thought that's where the bouquet of flowers were coming out. Okay, thank you. That takes us on to the clinical care governance. Oh, looks like it's Kenny's time for his shining in the sunshine. Kenny, clinical and care governance assurance. Can I hand over to you for this, please? Thank you.
Thank you, Chair. This report contains the minutes of NHS Tayside's Care Governance Committee on the 6th of April and Perth and Kinross Council's Scrutiny and Performance Committee on the 26th of April, where Perth and Kinross Council's Health and Social Care Partnerships Care and Professional Governance Forum full report was discussed. It also contains the exception reports from the Care and Professional Governance Forum, which were presented to the Care Governance Committee on the 1st of June and the Scrutiny and Performance Committee on the 7th of June. And just to summarise, the red operational risks discussed were in relation to accommodation, mental health, medical workforce, GP cover in HMP Perth, mental health waiting times in prison healthcare, capacity and flow, and care at home capacity. The Care Governance Committee and the Scrutiny and Performance Committee were assured with the mitigating actions in place to manage these risks. And risks in the exception report relate to restrictions on using agencies to fill nursing vacancies and a lack of capacity in the social work section of the Integrated Discharge Hub. And again, both the Care Governance Committee and Scrutiny and Performance Committee were assured that these risks are being managed through a range of mitigating actions. And also there has been, as we discussed previously, there's been discussed across Tayside regarding governance processes for mental health services. And it has now been agreed that the partnerships will continue to provide assurance regarding mental health services within their reports to the Care Governance Committee, and that a separate report which combines mental health services not delegated to the partnerships, i.e. secure care, general adult psychiatry and learning disability inpatient services, they will be brought to future Care Governance Committees. Happy to take any questions.
Thank you, Kenny. I think that's pretty comprehensive. Any questions, comments, thoughts? David.
In the Perth and Kinross Health and Social Care Partnership report, it talks about Perth Prison and the challenges there in getting medical support. It says that changes were made to the offer made to salaried doctors to provide this service, but in brief terms, what were the changes?
It was just an slight increase in the locum rates to attract people into the doctors into the prison, and we've been very successful actually in attracting quite a number of doctors, salaried doctors into the prison. So that's been quite positive, with a very small increase in the locum rate, which was approved and signed off by the NHS Tayside's medical director. Sorry.
Thank you.
Are there any questions? Is that Martin?
Thanks, Chair. I keep trying to type question in the box, but it just kicks me out. So, and it says on mental health and learning disabilities and mental health. I keep asking this question, and I know that there are some moves afoot, but mental health must, in my opinion, include addiction. And mental health and addiction are married together, and the fact that 53% of people who have mental health problems have addiction problems. So is this going to be reported here as well? Yeah.
Yes, certainly for the partnership services, we now have got separate governance arrangements for the mental health family, so to speak, which includes addiction services. And the plan is to have separate annual reports for learning disability and autism services, for mental health services, and for substance use services to go to the Care Governance Committee. But the plan is to have joint exception reports. So in terms of substance use services, they will all report through the partnership arrangements, with the exception of the inpatient detox unit up at Murray Rock and Cleveland, which will be part of this wider report going to the Care Governance Committee that we mentioned.
Thank you.
Okay. A couple of things from myself. Can I just ask if we're having any challenges for care with the ban on agencies and the attempt that's going on to try and reduce the amount of agency work across Scotland? Thanks.
So yeah, we are having challenges in and around the escalation to the tiers. So obviously tier 1 is within framework, so we can escalate over and above that. We're into tier 2, A, B and C, and we have some hotspot areas where we're really looking to bring on sort of more contracted agency time, but planning well in advance. Prison healthcare is obviously, we've had to make that an exception. It was escalated through to the executive management team at NHS Tayside and through to Scottish Government, and there has been an agreement for 3 months, I think it is, that we can continue to go to tier 2 agency, because otherwise we were struggling to get people with the right skill to be able to come in and do that job. So yeah, that is a challenge for us, and some of our rural community hospitals also a challenge, but beginning to settle down. So we're getting there with it, but we're still having to escalate obviously shifts on a more regular basis.
Just in case people don't know, there's a national initiative within Scotland to try and reduce the amount of agency work, to try and bring things back in line with the amount of people working for agencies instead of employed directly by services. So I know it's causing some challenges, so I just want some assurance that we're coping okay. Thank you. The other reflection I've had just listening, I mean, looking at the reporting through care governance, is some parallels there that should be with the risk, about where the risk sits in comparison, you know, linking into the care governance system. So it's something that we might want to reference when we're talking about risk management. The final thing that I was going to say, there was some issues raised of concern about myself as the chair of this group and also as the chair of the Care Governance Committee of NHS Tayside. After some discussions with Jackie Pepper, what we've agreed as a compromise, if everyone is happy, is when it's been Perth and Kinross are being discussed at the Care Governance and the reports are being presented at the Care Governance Committee, I will hand over to the Vice Chair rather than take those matters forward myself. So if everybody's happy with that, we'll just minute that we've addressed some of the concerns expressed. Okay. Okay, thank you for that. Sheila, do you want to come in?
Yeah, thanks, Beth, for that update. I fully agree with that proposal, and perhaps there may be something reciprocal at this committee when, if there's a care governance matter being raised at the this IGB Audit and Performance Committee, that perhaps whoever the vice chair is could lead on that. It's just an idea, so there's balance between the two.
It's an interesting idea, and it's one that raises a question that we've talked about in the past, that we don't have a vice chair in this group. And I know when I took over the chair, we talked about the possibility of having a vice chair with, you know, maybe somebody from the council side, similar to the IGB, but that maybe would raise that issue again. And I can pick that up.
Yeah, I did wonder who the vice chair was, I must admit, but so I think it's maybe.
Yeah, traditionally there's never been a vice chair.
But it's certainly something worth considering, you know, if circumstances meant that you couldn't attend one day, for example, Beth, or, you know, so, okay. But that was just an idea that you would maybe hand over a particular paper over to an appropriate depute within this committee. Okay, that's great, thanks.
Okay, thank you. Martin, you want to come back in?
Just on that question, I think it's a prudent idea, but there are also 3 members of the Audit and Risk Committee for NHS Tayside sitting in Audit and Performance in Perth IGB.
Sorry, say that again.
The 3 members of the NHS Tayside, right, Audit and Risk Committee, are actually sitting in Audit and Performance.
For the IGB.
And so that same, I'm unsure if the same procedure would then have to apply when we talk about audit.
I see your point, but I think the general agreement was that it wasn't a contradiction, but just because it was specifically raised by an individual, that we would take cognizance of the concerns and just do that compromise. But I don't think we would need to go into it for the Audit and Risk Committee of NHS Tayside and here.
But I would be believing that the integrity of the chair is sufficient to preclude having to have a vice chair, that being the case, that the professionalism and integrity of the chair should be taken into account. But
yeah, I acknowledge that, but I think the compromise has just been put out, and we'll watch and see how it goes. But thank you. I agree with your comments, Martin. Sheila, do you want to come back in?
Yeah, just briefly in response to what Martin said there, I kind of get where you're coming from, Martin. I think the particular situation is because Beth is the chair of both committees, which is which was the area of concern, if I'm right, Beth, is that correct?
Yeah, that's correct.
Yeah, so I think that's kind of slightly different, and certainly I know from, and maybe councillors are more familiar with this, if we felt there was something that was a conflict of interest, then we would be able to declare that. I mean, for me, myself, I'm not appointed by the Health Board to this committee, so I have a different hat on when I'm here, even though I have a different hat when I'm the Health Board Audit and Risk. So lots of us have to multitask and figure out a way to do it, and we just have to make sure that if there's any conflict of interest, we declare it early on and don't get involved in the debate, which is the normal protocol, I think.
Yeah, and that's certainly what we do at the beginning of the meeting as well. So hopefully that covers all eventualities. But since it was raised, I think we had to cover it. So thank you for that. Any other points around clinical and care governance? Is it now going to the scrutiny committee as well? So it goes there. Okay, that's great. Okay, the rest of the agenda is for information. And it's the Audit and Performance Committee work plan is there for your information. Has anybody got any points or questions they want to raise around that? Nope. And the Audit and Performance Committee record of attendance, you can now check that you're present and correct in the right places at the right times. And we have an item here, private discussion, in which the,
Hold on, Beth, before we come off that
Yep.
particular record of attendance, it's really about how the designations and organisations are listed. So, for example, I'm listed as a non-exec director, but actually on this committee, I'm an elected member of Perth and Kinross Council.
okay,
And equally, yourself and Martin are listed as non-exec directors under organisation, where you probably should be listed as NHS Tayside.
okay. Thank you for that. Well spotted. Phil?
Thank you.
My apologies for that. That's not correct, so I will rectify that.
Easy done. I never noticed it myself before. It's just because we've had this conversation about different interests, and I noticed it. So no big issue. If we can get it corrected, though, that'd be great. Thank you.
Okay, thank you, David.
Actually, can I go back to the work plan? And I note that there's a meeting for the 31st of July for one report, the annual performance report. Is that meeting really necessary?
Chris? Oops, sorry.
Thanks for the question, Councillor Allenworth. It unfortunately is necessary. There's a statutory deadline that needs to be met on the 31st of July for the publication of the annual performance report. So that's a single item agenda.
Sorry, item 9 is the private discussion, where we have the opportunity now to have a private discussion without the officers present with audit. We only usually use that if there's something we really want to discuss or questions we want clarified, concerns we would wish to raise. I don't think there are any members. Nope. Okay. Well, that just leaves me to confirm that the next meeting will be Monday the 31st of July, in which we'll be looking at the annual performance report. So can I thank everybody for their attendance today and for all the people involved in supporting the committee. Thank you.
Sorry, can I just come in there? My apologies. Bernie Campbell here.
Hi, Bernie.
Hi, it was just to say that today I haven't received the papers for this meeting today. I only got them this morning with the invite, so I'm not sure whether it's to do with my email. I have obviously emailed Phil and he's very kindly forwarded them on to me, but as the carer representative or one of the public partners, it makes it really difficult when I'm the one representative of the 4 public partners attending the meeting. If I don't have the papers, I really don't get the opportunity to read them through to contribute if I needed to. So I hope it will get resolved for the next time. It was always previously, so I'm not sure what's happened.
Okay, hold on.
Just thank you.
Hi, Bernie. Apologies for that. We'll look into that in committee services and make sure it's sorted for the next meeting.
Okay, thank you. Thanks, Bernie. Sorry about that for this occasion. So can I just bring the meeting to a close again, and thank you for your attendance.